Okay, good morning, everyone. I just did a whole, nobody could hear me. Could someone type in the chat box if you can hear me? Okay, I see lots of people typing. Okay, I'm going to try this again. I think we had it in the wrong mode. This is what happens when Danielle goes on vacation and I'm left to do the webinar. Good morning. I'm Adrienne Markworth. I'm the Executive Director of Leah's Pantry. I'm really excited to be here with you guys today and appreciate you taking the time to sit on our webinar. I'm joined by Sandy Dong. She will be jumping in as well. I'm going to turn the video off because it's really distracting for me to look at myself while I'm talking, but I did want to say hello. Okay, so welcome. This webinar is funded by the USDA, which is an equal opportunity provider and employer. Before we jump into the webinar content, we would love to do a quick survey. See if I can figure this out. If you see the survey, can you answer it? We want to understand who's on the call. We did see a very large registration list, which is exciting, but it does help me to know who actually is on here. Sandy, do you know how to do this poll?
Okay, so I'm going to end voting now, and I'm going to share results.
Oh, lovely. Okay, so we've got lots of people from LHDs, UC CalFresh, Catholic Charities, and some SIAs, a couple of people from Area on Aging, and we've got small and large counties with people from medium counties. Okay, perfect. Let's go back to the slides. Okay, so today what we're going to do is introduce Leah's Pantry really briefly for those of you that don't know about us. We're going to do an overview of our resources that are available to use in SnapEd, and then we're going to look at some scenarios of actual work plans and shots from different domains. During the course of this webinar, if you can just type questions in as you have them, we're going to batch the questions and do 2 Q&As, one just about our resources after that part, and then we're going to do another Q&A at the end in terms of scenarios. So if you type your questions in as you have them, then I can kind of get organized while Sandy's doing her section and get through questions. We are also going to share some documents. One of the documents that we've created is an Excel document which has model language that you can use in your integrated work plan that align with all of our different products and programs. In the PSE section, well, I guess there's not a lot of narrative in that section, and then the activities and the other activities. So Sandy can paste the link into the chat box for that, but we actually created a Dropbox folder with all of the materials that we'll be sharing during this webinar, so you don't have to bother with it right now if you don't want to. Okay. Having a little trouble seeing what I need to see. I think I lost a slide. Okay, so let's go into Leah's Pantry. So Leah's Pantry is an organization that many are familiar with. We work statewide, but we work very deeply in San Diego and San Francisco counties because that's where we have local staff, but we do direct education in multiple counties. We believe that everyone deserves nourishing meals every day. And the way that we make that happen is kind of in 3 ways. The first thing is we implement innovative programs that explore our relationship with food, support health, and build resilience. Another thing that we do is build capacity with partner organizations. So that's a lot of the work that we're doing under this contract, of course, is to work with all of you to make your SNAP-Ed programs really strong and effective. The third thing that we do is to start a different kind of conversation to really expand the frame of what we're talking about. And so this is where you've had probably some exposure to our feelings about trauma-informed nutrition education and how we can kind of collectively move our whole field forward. So the first thing, sorry, I'm a little disorganized on this screen. The first thing that we want to do is take a few minutes to go through the different Leah's Pantry products and programs. Sometimes people get a little bit confused because we have Eat Fresh and we have Food Smarts. Now we have the Nutrition Pantry program, looking at around the table. So Sandy's just going to go through all of our products and programs and explain them clearly so that before we jump into the integrated work plan part, everybody has an idea of what we're talking about on this webinar. And again, if you have questions as you're going through it, just please type in the chat box. So Sandy, take it away.
Thanks, Adrienne. I'm just wondering if anybody could hear me. If you can you type in the chat box that you can hear me? Great. So let's go over Leah's Pantry's products and programs that your county might include in their integrated work plan. We'll go through an overview of our 4 main programs. That's Food Smarts, eatfresh.org, Nutrition Pantry Program, and our newest curriculum, Around the Table. We'll also include training and technical assistant options available for these programs. On this slide, we want to highlight the first goal for the statewide program goals and objectives. There are a total of 4 objectives under this goal, but these 3 objectives are the most relevant for Leah's Pantry's products: healthy community changes, individual health behaviors, and food resource management. Let's start with Nutrition Pantry Program, our PSE intervention. PSCs set the tone for county work in each domain and have the potential for the broadest impact. As we describe each program, please enter any questions in the chat box. We'll take a break and answer questions before we move on to the scenarios. The Nutrition Pantry Program is new to CalFresh Healthy Living for 2020. The program itself has been around since 2016, and Leah's Pantry began to implement it at the end of 2017. Last year, we worked closely with state staff to align this PSC with the new work plan format. There's a lot of work that's been done in pantry settings over the years. The aim of this intervention is to make easy for pantries to organize work, receive high-quality materials, technical assistance, and collect data in a standardized way. This will allow great ideas to transfer between counties and for us to engage the impact in this area statewide. The vision of the Nutrition Pantry Program is for food distribution sites to be client-centered and health-focused. Adopting a client-centered model creates a foundation for selecting successful interventions to implement at food distributions. Food pantries are an incredibly diverse setting. We have created a model that balances structure and flexibility. The work is organized into 6 focus areas, serving as a framework for activity and evaluating impact. The program is designed to address each site holistically. The focus areas on the top row align with the 3 core PSC strategies for NPP: behavioral economics, nutritional standards, and access to healthy food. In order to implement NPP at a CalFresh Healthy Living site, work is necessary in the 3 areas. Additional complementary strategies can be included in NPP, such as capacity building, gardening, water access, and access to physical activity. The bottom row shows 3 additional focus areas of NPP that are typically accomplished through some mix of direct education, indirect education, training, and technical assistance. and community engagement. If your county chooses this program, you're able to select the mix that is appropriate for program participants at your pantry site. Adrian will highlight this in a scenario later in the webinar, and some sample language is included on the document we shared earlier. Let's take a look at the Npp process. First, the Healthy Food Pantry Assessment is gathered as a quantitative assessment, and a client-focused needs assessment survey is completed. Existing work is documented, and each focus area receives a seed, sprout, or bloom designation. Next, new work is identified with the goal of growing impact in each focus area. Training and resources are provided during the process, and new work is implemented and reported. Once the work is completed, pantries can be certified. The process can take from about 3 months to over a year, depending on the pantry. After the work is completed, the maintenance and monitoring process begins. This can include periodic check-ins, engagement by the pantry's ambassador to support other sites, and other low-resource activities. Certification is optional and can serve as an incentive and celebration point for sites. We've seen the impact of a strong nutrition pantry network within Catholic charities and in the San Diego area, and we look forward to supporting more networks through CalFresh Healthy Living in the next few years. So in summary, NPP is a comprehensive settings-based intervention for food pantry sites, which falls underneath the shop the shop domain. There are activities which are considered core, meaning you have to do them. Those are behavioral economics, nutritional standards, and access to healthy foods. Complementary strategies might include physical activity, water access, gardening, and other items. The NPP for Implementers training, which I will discuss more in a minute, will provide your staff or subcontractors with the resources they need to put these strategies into practice. Although NPP falls within the shop domain, it can complement other domains such as learn or live very well, as you'll see later in our presentation. For example, if your county is primarily focused on the learn setting, but there are several elementary schools or FRC partners that host food pantries, this could be a great way to sneak in work on the shop setting at those sites where you're already building relationships and doing work. The next question we usually receive is, how does my county adopt NPP and get access to the resources and technical assistance? Part of our contract with CDSS is to provide 2 trained NPP implementers this fiscal year. We don't have exact dates yet, but anticipate a July-August timeframe for Sacramento and a late August timeframe in San Diego or Los Angeles. We're also expecting to provide CalFresh Healthy Living staff and technical support as they implement NPP this year. If your county would like county-specific training or implementation support at the pantry level, please contact us and we can talk about what resources would be necessary. If you have questions about this intervention, please type them in the chat box below. Adrian will answer all questions that come in after we finish program overviews. Now we're going to talk more about our direct ed resources. So that's Food Smarts, Around the Table, and the eatfresh.org mini course. Food Smarts is a curriculum that was developed in 2006 and has been revised and improved over the years. The curriculum has an adult and youth version with accompanying participant workbooks and instructor guides. The adult workbook is available in English, Spanish, Chinese, Vietnamese, Russian, and Korean, and the youth workbook is available in English. The youth curriculum is approved for use in CalFresh for elementary through high school aged youth. The standard lesson plan is a series of 6 90-minute sessions, but lesson plans for alternative sessions and series lengths can also be evaluated and are approved for use. Food Smarts is a curriculum option for any domain where direct education is appropriate. Over the years, Food Smarts has been used in a variety of things, including shelters, housing, congregate meal sites, social service agencies, health clinics, pantries. You can select this curriculum within the Direct Ed activity module under Curriculum component. Let's talk about how to implement Food Smarts. If your county is currently using it, then you're all set. We'll just add it to the appropriate domain and setting within your IWP. If Food Smarts is new to you, there are a few ways to become trained. The first one, you could attend an in-person Food Smarts training program. This is 1.5 day training that will prepare you to lead a 6-week Food Smarts workshop series. We have funding to facilitate one more FSTP this year, which will likely be in late spring, early summer. The location and exact dates are to be determined. 2, this year we will be hosting a 3-part web-based FSTP. The training will be broken down into 2-hour segments and will take place in August. Once the dates to these trainings are set, you'll find all the details, including registration, on our website's capacity build page. I'm adding the link to the chat box right now. Another option, a third option that you have is that Leah's Pantry can also come to you to get your team up and running. If you're interested in learning about the pricing and customization options, submit an inquiry through Leah's Pantry's contact page or reach out to our training manager, Danielle. I'm also including this information in the chat box now. Trained agencies have free access to digital files and Kent worksheets for their classes. Alternatively, printed workbooks can be purchased in bulk through Leah's Pantry or directly from Amazon.com. Black and white workbooks are $5 each, and color workbooks are between $8 and $10. These purchases can be made on our website, and we're always available to answer questions. Now I'm going to hand it over to Adrian, who will go over Around the Table and eatfresh.org products.
Okay, if you attended the local implementing agency forum in January, you may have seen Monica and I talk about Around the Table, the new trauma-informed curriculum we're developing in partnership with CDSS. We'll start with this slide because I think it sets the right frame for this work. To use the word trauma-informed for this curriculum has the potential of creating some confusion. So we want to first articulate what this curriculum is not. This curriculum is not an intervention designed for individuals who have been specifically identified as having experienced trauma. This curriculum does not screen for trauma in any way, and this curriculum does not intend to specifically remediate damage caused by trauma or toxic stress. Instead, this curriculum supports healthy dietary behaviors by aligning to a set of principles we've identified as important for effectively engaging populations who are likely to have had experienced trauma or toxic stress at the individual or the community level. Evidence supports that there are high rates of individual and community trauma among low-income populations, and we believe that all individuals benefit from interventions that align with these principles. First, this curriculum recognizes that adversity and toxic stress have an impact on our diet, health behaviors, disease risk, and our relationship with food. Second, the curriculum integrates strategies that avoid inadvertently creating or reinforce the practical or emotional barriers to healthy behaviors. And last, the curriculum builds confidence in cooking and food resource management through cooperative work and mindful eating. Overall, the activities and curriculum prioritize relationship building, participant voice, and joyful, dignified engagement. Discussion activities explore connection to food and community. Mindful eating and centering activities teach stress reduction techniques. Participants self-organize, prepare the food, and choose the recipes. A broader view of food is introduced, one that accepts the importance of food in multiple domains in both physical and mental health. Care is taken to level the power dynamics that exist between facilitator and participant and between participants themselves. This curriculum is undergoing a pilot, and we're hoping that it will be added to the pilot tab of the curriculum list soon. If the timeline works out, counties would be able to add this as a curriculum, provided they're comfortable with an emerging intervention. If the timeline ends up being delayed, we would suggest adding this curriculum under the Innovative Practice section of the work plan. If your county would prefer to wait until the pilot results are in, consider adding this curriculum for use during FFY21 or FFY22. Around the table will work in any domain where you might use direct education, but the curriculum is not as flexible as Food Smarts. This is a 6-week curriculum designed for groups of 7 to 15 participants. The adult curriculum will focus on primary caregivers, and the youth curriculum is designed for ages 14 to 21. We have a one-pager for Around the Table, which includes a lesson overview, and Sandy can paste that link in the chat box right now. We'll also share it at the end of the webinar. Okay, if you're interested in implementing Around the Table, here are the options. It's possible to pilot the adult or youth curriculum this fiscal year. If you're interested in that, reach out to Monica or me, and we'll talk about whether that's feasible. But the standard implementation will be first to attend one of our roundtable training programs. We're planning on having one in Northern California and one in Southern California this summer, and similar to NPP, you could also work with us directly to provide a training in your county that aligns with your schedule. I'm hoping that we will organize ourselves and have all of our dates up on our website in the next 3 weeks. Like I said before, if you're interested in implement this curriculum, but you don't think you're going to be ready in October, or you're not really up for kind of such a new intervention, just make sure to choose the later years on your integrated work plan. Materials are going to be similar to Food Smarts in that you'll be able to have digital download of the materials and also able to purchase them through Leah's Pantry. It is a little bit, it'll be a little less expensive because there's just less materials than there are for Food Smarts. Okay, if you've got questions about this, just type them in the chat box and I'll answer questions before we move on to the scenarios. Okay, eatfresh.org mini course. This is a free online self-paced course with 15 topics that cover nutrition, cooking, and resource management. It's designed for adults and available in English and Spanish. It's mobile friendly. This resource can be used in multiple domains, really anywhere direct education is appropriate. You can enter this into the work plan in the same way in the direct ed activity module under the curriculum component. I will say this can also be used for training and technical assistance for volunteers or staff or partners. So this can be pretty flexible in that way. And we'll talk about that when we go to the scenarios. Implementing eatfresh.org mini course is pretty easy because you just have to go to the website and start doing it. We can provide a referral code to your organization so that we can help you track your program participants. This would allow us to share with you how many of your program participants have created accounts, how many topics they've completed, as well as their basic demographic data for pairs. As some of you know, though, this intervention can be a little tricky to implement. It is a way to offer a direct education intervention to clients who are not able to attend something in person, but it does require that the client have a way to access the internet and be motivated to take the course. We've found that incentives for completion really help, such as a cookbook or other reinforcement item. Some partners will offer an in-person mini course, which has been well received, but again, that doesn't meet the needs of those unable to attend direct education class. We have found, as I mentioned, that the mini course is an effective tool for staff and volunteer training, and it can be used in the training and technical assistance section. We actually hosted a webinar on this topic last year, and Sandy can paste the link to the webinar in the chat box right now if you want more information on this. If you're interested in learning more about how to implement the eatfresh.org mini course within different settings, please reach out to us. We'd love to share some best practices and create an implementation plan with you. The other thing I'll just add in here is the data entry situation into pairs can be done in several different ways. In years past, Leah's Pantry has done all of the data entry for the mini course, but as more and more counties write it into their work plan, they want to do their own data entry. And so we would like to have a conversation with you about how frequently you would want mini course participation reports sent to your county and just how all of that works. So that's no problem at all, but we do just need to connect with you about that. Okay, any questions about the mini course? The chat box is open for your questions. Okay, eatfresh.org. I think most of you already know about eatfresh.org, so I'm not going to really go over it too much, but it is a recipe and nutrition website designed for the CalFresh Healthy Living program. It's available in English and Spanish and Chinese, and it can really complement a very, very wide variety of programs and settings. And I think that's probably been what we've learned the past 3 years of running this program, is just that people use eatfresh.org all the time and in so many interesting and creative ways. We're always learning about what people have done. In the integrated work plan, it's entered into the all other activities modules, usually under indirect ed, but it could also be entered under training and technical assistance, depending on what you're doing with eatfresh.org. If you're doing a direct client referral, I guess it would be indirect ed. And if you're using eatfresh.org to train other providers to refer it to people, then I think it would be under training and technical assistance. So it really depends on the unique model that your county is going to adopt. We have tons of resources for implementers, and all of those are found on our website, as many of you already know. So in order to implement this, you can use it to find approved recipes for your nutrition classes. It can support nutrition, it can support food demonstrations, work at farmers markets or food pantries, county welfare departments, social services office, really anywhere. We've included some ideas on the sample language Excel sheet that we shared at the beginning of the webinar, but we're always happy to collaborate with your county's integrated work plan team to think of other ways to merge it in your existing program. You can access more information on our integration toolkit, which is on the website. Also know that CalFresh Healthy Living funded partners, I'm really trying hard not to use SnapEd, I hope everyone can tell that, can order free materials. And so that's obviously a great resource for your county. It doesn't have a budget impact for you. We have a budget from CDSS to support CalFresh Healthy Living partners throughout the state. So register on our website as a partner, and then you can order things like recipe cards, posters, DVDs, and then that ends up getting them to where you need them. Okay, so that's eatfresh.org. I did want to take just a second and remind everybody about the eatfresh.org mini course for educators. This resources, I think, is maybe one that not everybody knows about. It was developed as an offshoot of the eatfresh.org mini course, but the 5 topics were designed specifically for nutrition educators. So like the mini, it's available in English and Spanish and is mobile friendly. The 5 topics for educators support leading efficient and effective classes using CalFresh Healthy Living messaging, adult learning theory, and facilitation best practices. The topics do incorporate ideas on how to utilize specific resources from FoodSmart and eatfresh.org, but I want to just say that the course was designed to be useful for any nutrition educator, not just those educators working on the FoodSmart's curriculum. Each topic takes like about 20 minutes to complete. Okay, how to implement the eatfresh.org mini course for educators. So for the regular mini course, we would give your county a specific code. and then you would then use that code for your clients. For the mini course for educators, everybody uses the same referral code, and that referral code is TEACH. If you enter the referral code TEACH when you sign up for the mini course, it will automatically enroll you in the right version of the class. If you already have an account and you want to add the mini course, you need to talk with Sandy at leahspantry.org, and she can enroll you in the class manually. This is a great thing for bringing people up to speed, for training educators or community volunteers. It's a great reminder of SNAP-Ed nutrition messaging, and you can incorporate it into a wide variety of activities. Okay, so we just did a whole lot. And I think Wendy is replying to Rebecca's question about where to order the Food Smarts workbooks. So I don't have to answer that. Okay, I didn't see any other questions come through. I'm just going to scroll up here on the chat because we were sharing things the whole time. Okay, does anybody have questions about the products, or I'm going to kind of jump into the scenarios for our last 10 minutes here. Okay, what we did for this last part is create a couple of different scenarios that show how to incorporate Leah's Pantry into the work plan. We've spent a lot of time in the work plan, as have all of you, and I kind of like it. We know that all the local health departments have to work in the Learn domain, so let's start there. So for this, let's pretend that we are writing a work plan for a county that wants to work with a group of, say, 25 elementary schools. Some of these schools, maybe 10 of them, have gardens on site, 15 of them do not. Some schools actually already have on-site food pantry or want to start a food pantry. We know that school settings are high impact sites, right? You get a lot of important work done, but they can also be tough to work in. You know, over the summer, the school garden that you supported might get bulldozed by a whole site modernization. Your favorite principal might get reassigned, or maybe like your most effective community educator makes a move. So for this PSC, let's say we're going to choose the comprehensive settings-based approach, which is just kind of a lot of stuff. And so that way you have the flexibility to work at the different schools and take advantage of the opportunities that you have. So let's look at how our direct education products can support something happening in the Learn setting. So we're spending some time providing healthier foods for our students, but we want to make sure that we're also doing some whole family programming so that the kids are getting the support at home and they're getting the support at school. The messaging is consistent and it's more of a community change. A lot of the schools in our county have active parent volunteers, and a lot of the principals do a great job of providing educational and social opportunities for our parents, whether that's through a parent engagement center, whether that's through garden volunteers or even pantry volunteers. So we are going to look right now at leveraging those relationships. So for example, here, you can see that in the Learn setting, we might be providing direct education to adults through the volunteer engagement centers, and maybe for our garden volunteers, we're asking them to complete the mini course online at the school computer lab. So you can see that I've added both of those different curriculums to my direct education activity. I also might wanted some indirect education. The schools with gardens might have a harvest festival or a garden fair every year, and that can be a great time to use eatfresh.org to support the preparation of foods that are in the garden using the Discover Foods page. It could be a great way to do recipes. You may just have a health fair or some kind of community resource fair that CalFresh Healthy Live partner in at these schools, maybe at the beginning of the school year, getting backpacks out to the kids, or health screenings or dental screenings or whatever kinds of things that the community needs. And you could involve eatfresh.org resources at your table or whatever way that you're involved in this. You could also work with staff and teachers to buy into the nutrition standards by having them take the mini course. So maybe you're changing the way that things happen at the school, and you're trying to make sure that all the stakeholders are involved in changes in policy or changes in the way that celebrations happen or staff meetings happen or whatever it is. So sometimes really working in a direct education way with staff and teachers can help them support the broader PSC changes. Okay, so this is something that I want to mention because I did talk about in the beginning of this scenario that we have some food pantries that we're working with at these schools. So food pantry work for the nutrition pantry programming is the shop setting. But it could be at the same school, right? So it's different domains at the same physical address. And so if you thought, well, we want to make sure that all the programs in the school are aligned around similar health values. So if we're doing healthy procurement or smarter lunchroom at these schools, we definitely want to make sure that the foods offered in the food pantry are also in line with those health values. So families who are in need would be taking home nutritious foods that would also be food that they want to eat and know how to prepare. So CalFresh Healthy Living could support the food pantry through the shop setting without necessarily having to take on the entire shop domain, but just knowing that you're already working school sites would be a way to add some work there. So you can see here, you select shop and then you select food pantries and then you select the comprehensive settings-based approach, and then you'll see the nutrition pantry program over here as a sub-strategy activity bundle. I also added gardens on this screenshot since we know some of our schools have gardens and the gardens can sometimes feed the food pantry. Also some capacity building for food demonstration because maybe there are some grants available through our local food bank that can support shelving or refrigeration for food pantries. Okay, so then the next screen here is going to show how you might use direct education. Maybe you have pantry volunteers who are parents working in the food pantry, and they might be able to do nutrition education through the eatfresh.org mini course as part of their volunteer onboarding. Then you start to see some of the nutrition pantry program activities, and this is all stuff that you learn in the implementer training, and this is also on the Excel document that we shared, but just to give you a sense of what this can look like, right? We do have an assessment, so you may want to do the healthy food pantry assessment and use the NPP work plan for pre-post. You may want to do some community engagement, and the two examples that I gave in this scenario would be to, first of all, engage your local inventory resources. So that could be your food bank, it could be local farmers and gleaners, it could be other restaurants or other people that might have excess items to donate to the food pantry, and kind of maybe the school garden, just to kind of see what are the assets available in our community, how can we start a food pantry, how can we make our food pantry healthier. The other way that you can use the community engagement is to convene the staff and all the different stakeholders, whether that's pantry clients, volunteers, staff, all the people to figure out what do we want this food pantry to look like at the school? What do people really need? And this is part of the needs assessment. In terms of indirect education, obviously Eat Fresh recipe cards can be used within the pantry to support food. We know that you can give out as much healthy food in a food pantry as you want, but if people don't know how to prepare it, it's not getting into their bodies, so it's not doing the work it needs to do. There's some more sample language found in that integrated work plan Excel document around things like bundling and nudges and environmental changes. So you can see how this is all happening within the same school site, but we're using Leah's pantry materials in a lot of different ways. Okay, let's just look at the Congregate meal site quickly as well. This is actually a real life picture of us working in a Congregate meal site in San Francisco. In this scenario, it's the eat scenario, and again, we're going to do a comprehensive settings-based approach, but we're going to focus on some of the things that we can do at the Congregate meal site. For example, we can run direct ed food smarts workshops for seniors who attend Congregate meals. We can just do more indirect ed with food demos during the mealtime or brief activities or conversations. And then we can also work with the site staff, especially if you're making changes in the health quality of the meals being provided. Sometimes the staff needs a little bit of a nudge to get on board and excited about some of the changes, especially if it ends up being more work from them or they have to deal with clients' feedback about changes that are being made. Change is really hard for everybody, even when they're good changes. And so how can you support everybody to support the work that you're doing? So this is kind of how this would look if you're thinking about older adults. You've got your Food Smarts workshops in there, and then what kind of evaluation tools you're going to use. We have the pre and post workshop for adults, but I imagine most of you are going to use whatever the state decides is the direct education tool, and that's just fine. You can use whatever evaluation that you want for Food Smarts. And then here's the indirect education and the training and TA stuff that we talked about. Okay, the last domain in our last minute here. And then I see a couple questions came in. For the live domain, I know a lot of interesting work is happening in healthcare. And I mean, I couldn't even decide on a situation for this domain because there was just so many examples that we were all thinking about. I think more and more we're able to partner with oral health, behavioral health, farmers markets that are happening in healthcare. We've been working at food pantries happening in healthcare, which is a really, really interesting and emerging intervention that is going to require kind of an all hands on deck approach to make sure that it's implemented all. I think for oral health, using Food Smarts and Eat Fresh can be a great way to encourage healthy snacks and beverage choices, which is definitely something that dentists are focused a lot on, getting away from those sticky, sugary snacks, very far from teeth brushing time. Training clinic staff to refer families to eatfresh.org and distributing recipe cards. Around the table could be worked in a behavioral health clinic for sure. And then even looking at how you can participate in the farmers market that might be hosted by a hospital or a health clinic through eatfresh.org. We've had a lot of work just talking with doctors, nurses, and other providers, bringing people together to try and standardize the nutrition messages and make the conversations and resources more actionable. So instead of just handing a client a handout of my plate, actually engaging that client and talking about food preparation and resources and more practical skills, as opposed to just kind of theoretically you should be eating healthier, but how do we use that 5 minutes to really engage them in a more actionable conversation? So I think SnapEd can do a great job with that. Okay, we're at the end of our time here. I kind of flew through the scenarios, but I've got a couple questions. Joy, can you share the timeline slide for around the table rollout? Yeah, we don't have times yet. I'll go back to that slide. We are working on a couple of different components that the training would have. One of those is going to be a webinar that you can watch in advance of the training, which is engaging teens using trauma-informed principles. And we're working with the Center for Adolescent Studies on that, really excited about it. So we're gonna have some pretty high quality training materials to get people ready for the curriculum. So that people feel comfortable and they choose the right organizational partners to implement it with. We're really looking for organizations that are able to retain the same group of clients. We're looking for organizations that have had some understanding of trauma-informed care and there's consistency within the organization, and that SnapEd starts to develop this capacity as well. So I'm thinking July, August is a timeline. We may be able to roll out some materials in July and then have our in-person trainings in August or September. Anna, yes, the slide set is going to be inside the Dropbox that Sandy will share at the end of the webinar. If you cannot access Dropbox because you're on a restricted computer, we can send you the files individually. Do you have suggestions on how to tie in the early childhood education and food pantry access to food where Leah's trick can be utilized? We will be in the learn domain. Yeah, we've done a bunch of interesting work with ECE. And it has been working with the parents and the providers around training and technical assistance. If you're going to work at a food pantry, even though it will be in the Learn domain for most of your work, you can add the domain in and just have the same sites. But Donna, if you want to email me, I can definitely brainstorm with you. Shannon, the NPP pamphlet is going to also be in that Dropbox folder, and it was written for peers, so it should be it should be the right elevation of information, not too wonky, but we are also looking for feedback on that. So if you guys send that NPP pamphlet to partners and you get feedback that's not 100% positive, or if there's confusions or questions, it would be incredibly helpful if you guys would email us those questions and concerns so that we can continue to refine our materials for the different audiences. Again, Shannon, how do we access the educators at Eat Fresh mini course? So when you log on to the mini course, which you can find from eatfresh.org, the homepage, let me go up here and look at it. Okay, so on this slide, you can see take the eatfresh.org mini course. Oh, I have a fun pencil. Look at that. If you click that, when it says referral code, which you'll have to add when you start an account, if you do teach, T-E-A-C-H, it will kick you into the educators course. Okay, is there a list of activities related to each of the 6 areas or the NPP? Jennifer, yes, and all that stuff will be in the NPP for Implementers training. We have leading practices in each of the 6 focus areas with suggestions. Ultimately, when you create your work plan, you're going to first identify what's already happening. Then you're going to say, what else could we do? And for that, what else could we do conversation, it can be a combination of taking ideas from other pantries and from our leading practices documents, and then just your own creativity about what's possible. And we can send you some examples of that. What does the NPP certification look like? Once you've completed your work plan and you have your seed, sprout, bloom identified in every category, we will review the work plan at Leah's Pantry and probably agree with your assessment. This is a gold certified pantry or silver certified pantry. We have a couple of different criteria for that. I know I flew through that slide. Oh, I just saw it. Hold on. Okay. Once that happens, we've done the actual certification in a bunch of different ways. We just did one in Fallbrook and they had media there and their whole board of directors and it was a big deal. Sometimes we do it at a volunteer event. We've recognized certified pantries at county collaborations like the North County Food Policy Council in San Diego. So they would get like aprons and a window sticker and a certificate and a digital badge for their website, and they can use it in grant proposals. If they're writing grants, they can say, oh, we're a gold certified pantry. So Leah's Pantry, through our technical assistance for NPP, will work directly with all of you as you implement to make sure you have the resources and support that you need. That's part of our contract with CDSS, is to support you guys. So we're not just kind of putting all of the information out there right now. We really do want to have a relationship with everyone that's planning on implementing NPP so that we make sure that the rollout is smooth. But the NPP for Implementers training would be something that you'd want to participate in. And I see that Wendy just did the certification overview, so you can see a little bit more about that. Okay, did I answer all the questions? I think I answered all the questions that came in. I hope this was helpful for everybody. It was really helpful for me because I learned a lot about the IWP. And I think you all have my email. It's adrian@leahspantry.org. There's my phone number if you want to call me. Okay, and thank you guys all. I see a couple more people typing. Thank you, Joy. Joy just said thank you to me, but really I should thank her because she was one of our first gold certified pantries through Catholic Charities this year, her pantry that she works with in San Diego. And yes, the slide presentation will be in the Dropbox folder. Okay, so I think we're going to sign off. Thank you guys so much. Have a great morning.